Now you are almost 10 years into practice and you are having a busy practice. Do you get time for yourself, for your family, for your son at the age of, let's say, late 30s? Or do you feel it's too busy, there is no time for self, and that work life balance is not there?
So it depends on yourself. Now, I can say that when I started my practice in the first few years, because it was COVID times, practice wasn't very heavy. I did get a lot of time with my son, my wife, my family, everyone. Then, as practice got busier for the next few years, I think practice again, kind of picked up. I was trying to focus too much on practice, and that was a time when my work-life balance suffered. But I mean, there's a curve. Once you hit that peak, you realize that it's once you plateau rather after hitting the peak, you realize that work-life balance is important, and that's when you have to consciously make a decision or an effort to kind of weed out certain types of surgical patients, or certain not accept certain types of patients, or not go to certain types of hospitals, and eventually you will get enough time for family and for your kids.
So, as I see it, the more senior you become, the more you're able to generate time for yourself and balance in your life. It's not
Absolutely.
all that I'll be working 7 days a week, 12 hours a day, and I'll have no time for myself or for my family.
Absolutely.
That's exactly what I wanted you to say, because I tell this to students all the time, but they're like, you know nothing, you are just promoting your branch. That's why I called a practicing surgeon who is in the peak of his practice. And I'm sure as you become more and more senior, you will get more time, but students don't see this.